The number of people hospitalized with COVID-19 has been a key statistic informing policy throughout the pandemic, but not all COVID hospitalizations are created equal. As the Omicron wave puts a strain on healthcare systems across Canada, some jurisdictions have started separating hospitalization numbers based on whether a patient was admitted for COVID-19 or for other reasons but tested positive during screening. The latter are often known as incidental COVID hospitalizations. That means not everyone who is in hospital with COVID was admitted because of COVID. However, the country's top doctor says the key thing to remember when setting public health policy is that hospitals are still stretched thin whether a patient has incidental COVID or not.
I guess the bottom line is this variant is having a very significant impact on the hospitalizations. But the other thing that's very different is that, of course, staff are getting sick at the same time. So that's putting a lot of pressure on the hospital systems.
The numbers vary from province to province, with about 1/3 of COVID hospital admissions in Saskatchewan being considered incidental, while in Ontario, that number is closer to half. ICU numbers also differ from province to province. For example, Ontario has 82% of COVID-19 patients in the ICU admitted for COVID as of January 18th, compared to 18% who are considered incidental. Infectious diseases specialist Dr. Isaac Bogosh says determining which cases are incidental can be difficult.
You have people who have a COVID-19 infection who have overt signs and symptoms of COVID-19 that bring them into hospital. Sometimes you have people who have a COVID-19 infection, but it exacerbates an underlying medical condition. So someone has an exacerbation of their emphysema, someone has an abnormal heart rhythm, someone has a fall, and a lot of this was driven by a COVID-19 infection. I'd be very curious to see how those individuals are categorized. Some people, of course, have something completely unrelated to COVID-19, totally unrelated. They come into hospital and they have an incidental finding of COVID-19. It's important to know. Some people acquire COVID-19 in hospital as well. That's also important to know.
Dr. Nathan Stahl at Mount Sinai Hospital in Toronto says the number of incidental COVID-19 patients should be interpreted with care.
When I look at it, it is one piece of data that I, question, the proportions and numbers that I'm seeing based on the challenges with definitions. I do not consider it nearly as importantly as things like number of hospitalizations and ICU admissions and staffing shortages and the downstream consequences to care.
Also at issue is the impact a COVID-positive patient can have on the healthcare system. When a person tests positive, whether they were admitted for COVID or with an incidental case, it can trigger the need for more stringent healthcare protocols to protect both staff and other patients. Dr. Jesse Pappenberg of Montreal Children's Hospital says that in turn creates further strain.
Any person with a SARS-CoV-2 infection, depending on what type of procedures done, what clinical condition the patient is in, may require additional infection control measures to be put into place, which are burdensome and costly for the healthcare system.
There's also been concern among some health professionals about whether releasing incidental data is helpful. Stahl is concerned releasing these COVID hospitalization numbers may result in the downplaying of the severity of the virus.
So if it helps health systems plan for therapeutics and for anticipated critical care use and that sort of thing, I think it could be helpful. It can be weaponized. The data can be weaponized in so many ways that downplays a real difficulty and human tragedy for so many people across this country.
Provincial health officials have defended the decision.
It does have an impact on things like infection control practices in the hospital, but it does also give us a measure of where we are in terms of impact.
We're providing this data to inform planning and in alignment with other provinces' reporting. However, it is important to recognize that any COVID-positive admission has an impact on our acute care capacity.
Opinions are divided on how to interpret these hospitalization numbers. But Canada's Deputy Chief Public Health Officer Dr. Howard New says regardless of why they were admitted, the focus should still be on reducing the overall burden on the healthcare system. Sean Previl, Global News. Thanks for watching Global News. If you're interested in more national and international news, be sure to subscribe to our channel.